Good morning. This is Cheryl Dalton-Norman with Industry Insights with Cheryl, and I am so excited to have my good friend Deepesh Chandra here with me. Deepesh and I have worked together in the past, and he is really a brilliant leader in the space around digital, IT, and all things related to that. So, Deepesh, thank you for being here with me today.
Shell, thank you. And hello, everyone. As Shell said, my name is Deepesh Chandra. And just to introduce myself, I am currently the Chief Information Officer for Montefiore Einstein, which is a large academic medical center here in New York City. Happy to be here.
Oh, that's great, Deepesh. Thank you for being here. Can you tell, I know that you've really worked across the IT industry for, I won't say a long time because we're super young, but you've worked in the consulting arena, but also really helping large health systems navigate change in the world of IT and digital strategy. So can you tell us a little bit more about your background?
Absolutely. So Cheryl, as you mentioned, I have worked always at the cross section of healthcare and technology, and throughout my career, that's an inspiring work that I have been part of as health system and more broadly health industry have been adopting more and more technology. And every 5 years, there will be a new evolution and a new wave of a transformative technology, whether it is data or AI, and currently generative AI. So I've always found it very interesting for how healthcare adopts them and brings them to its users.
How have you seen over the past, let's say 10 to 15 years, digital transformation reshape health systems that you've worked with?
Yeah, it's a very interesting trend, and I would even extend that timeline a little bit, going back almost 30 years. We call a lot of these changes through technology as digital trends now, but 30 years ago, health systems started adopting digital technology and beginning to digitize our health records. And some of these trends have really accelerated in the last 10 years, where we have seen every single aspect of care delivery and our operation being technology enabled. And a more and more adoption of that has happened. And today we see these technologies being used at the every interface point of healthcare system, whether you're trying to search for a care, trying to make an appointment, either you are during the visit or having an inpatient visit in a hospital or post-care or even in a long-term care management. Technology is embedded in every aspect of our care delivery today.
Yeah. Yeah. You know, as I think about my own interactions with the health system and those of my family, how do you see health systems really taking a look at generational differences? As I look at my 92-year-old mother trying to navigate healthcare versus my 30-year-old son, do you see health systems being able to work across the generations with different capabilities around technical resources?
I do, at least I hope our technology crosses these generational barriers for us. We always attribute some of these newer technologies to the younger generation more so, but we are reaching a point, at least with mobile technologies, that it is being used more and more with our aging population as well. It has taken a while for the adoption to come through, but I think we are seeing more and more adoption of these technologies with our aging population as well. And something that is becoming a lot more interesting is with the new technologies, some of these devices and interaction with these technologies are becoming more human-like, which is lowering the barrier of the technology adoption with our population. So the engagement with what used to be with Siri and Alexa many years ago is becoming a lot more conversational and less robotic and becoming more empathetic. And so I think these technologies are, as they evolve, we are going to see those generational barriers being lowered further. And that's really a hope for us as an industry.
That's a great point, Depeche, because with new AI capabilities, even if I'm calling from my flip phone, I can be interacting with an AI that is really, to your point, empathetic and can really be conversational with a senior in a way that really encourages their engagement with the health system. So that's super cool. As you think about AI and as a chief information officer, what do you see as the biggest challenges in really implementing and driving the effective utilization of AI in health systems?
I think there are two key challenges that we all should keep in mind, and it's just not with AI, but technology more broadly in general when we are trying to introduce them into our ecosystem. I think number one that I have paid more importance to than anything else is how do we bring the business and the clinical leaders along in making those decisions about the technology. One of the reflecting aspect that I always focus on as what has gone well and what has not gone well is the difference often comes down to it, whether the technology was the business leader and the clinical leader's agenda, or was it a CIO's agenda? And it's really important because it changes how we help drive change management forward. How do we make sure that we will get the most value from our investment? And that only happens when we have the business and the clinical leaders making these technologies as their own agenda. And I think the second aspect is always on top of our mind is what kind of new risk does these technology bring to our overall operation? And we definitely know cyber is an important problem, but then there are other aspects that could bring or has a potential to cause patient harm. And so for us to understand, given the industry we are in, always counterbalance these aspects with the risk that we are going to undertake by bringing these technologies into the mix.
Dipesh, those are two really great points. And your first point about including the business and the clinical leaders, you just really have reinforced. I did a session with Bree Laughlin from Nurse Disrupted, and her direct comment to me was, we shouldn't be building technology for nurses without nurses. And to hear you as the CIO of a major health system saying that, understanding that deeply, I think that's so powerful. And my hope is that healthcare executives and CIOs across the country are thinking like you are about, we can do a lot of things, but we should do them with the people who are using them and need them and want them and partnering. So thank you, Depesh. That is great. What are you most excited about in seeing with AI or other digital technologies? What do you think in the next 5 years, let's say, will be the most exciting outcome for health systems in that arena?
I think, Cheryl, there are two key trends that I feel very positive about. In near term, I think there are going to be real tangible impact that AI can bring to our operations and back office operation in healthcare. Um, I think this is not no longer something that is a theoretical concept. Many health systems, many players in the healthcare ecosystem are actually using AI to significantly improve their back office operation, whether it is rev cycle, supply chain, their IT. And AI really has found its maturity point where it can drive a lot of optimization to those back office operation. And you can see real value coming out of it in a very short period of time. I think a bit midterm, we are going to see adoption of AI in a significant way in our clinical operation. We have seen early signs of that happening in our population health space, where we can better risk stratify our patient, where to focus, where their emerging needs could be. And that is now beginning to uh, trickle down into proper clinical diagnosis, as medical devices are beginning to embed artificial intelligence in identifying, um, you know, disease patterns and images and things like that. So combine those two aspects of the administrative side of healthcare and the care delivery side of healthcare, we are going to see a combined effect of AI in a very, very positive way in the coming years.
That's great. That's great. One of the things that I see in working with clients across the country is there is a very marked difference in comfort level and willingness to be first to engage in AI tools. And even though we see them, I mean, it's pervasive in all these different areas of our lives, but as major health systems are looking at AI, what would be your caution to executives about delay and or being too far forward? Is there a sweet spot? Because I don't know what that would be.
That's a top of the mind question for everyone in healthcare. How much should I go into it today versus tomorrow? And those are really important topics to discuss. I think it boils down to a few areas in as part of your decision making. Number one is being having a full understanding on how your data is going to be used by the AI is really important, because as a healthcare industry, we have very strict guidelines around use of identifiable data about someone's health. And how do we use that information in training artificial intelligence is an important privacy question, something that the industry is maturing toward, and it requires careful navigation on that topic. That's definitely one. I think number two is for us to fully understand the efficacy of the AI that we are about to deploy, and a potential downside of that AI should something go wrong. We are a very risk-averse industry for all right reason, because we care for people's lives. And so we want to absolutely make sure that it would do no harm to our patients, to our care delivery. And I think having a very significant diligence on that front is really important. And I think if you combine those two aspects, it comes down to your ability to navigate what you're trying to deploy, where you are trying to deploy, and what could go wrong. Understanding that is really important before you make your decision to adopt it.
That's a really great point. What is the safety net, per let's say, if this didn't work in the moment? Almost like an AI business continuity plan, if you think about it in that way. If something failed or didn't work correctly, can we still take care of people effectively in the face of that? So,
I always give a analogy of this with autonomous cars. So as we begin to find our ways with autonomous car and become more confident in using car driving itself, what if we start losing our own driving skills? And if a car can drive itself, can we still take the wheels? We are probably a decade or two away from those situations in healthcare. But eventually, yes, we are seeing that with EMR, that originally when EMRs were rolling out, a doctor or a nurse could easily go into a downtime procedure. Today, they find it more difficult because they are a lot more trained in EMR. That's their go-to platform for recording healthcare. And it's harder and harder for the current generation of our care providers to go into those paper and pencil downtime procedures.
oh yeah. I mean, I think about when I was in nursing school over 40 years ago. It's like I wrote everything out. That was no big deal. But today, if you're just coming out of school, you've never handwritten a word. So yeah, yeah, that's a great point, Depeche. I love that. I love that. I want to pivot a little bit to talk a little bit about cybersecurity. And all the things that have been happening nationally. I've been getting in the mail documents offering to protect my personal information because of cybersecurity failures. How how do you see that impacting? We know there was a huge financial impact for health systems. How do you feel like the fear or concern about cybersecurity can be effectively managed to not slow down innovation?
It's a very fine balance, Cheryl. As a industry, cybersecurity has become the number one threat to a hospital operation today by a very far margin. We are seeing healthcare industry being number one target for cybersecurity threats. We have numerous examples of patient care being diverted because a cyber attack happened at a healthcare facility, and it brought the entire system into a gridlock. So I think it's an important balance that how we as operational leaders and technology leaders come together to understand where the key gaps are as compared to an industry standard. How do we close those gaps? How do we quickly make sure that we have certain degree of operational resiliency? We have our response plans in place, and there is a clear understanding of roles and responsibility in those moments of crisis. I think that's really key. And something that you just highlighted, it's paramount that we educate our users, our clinicians, our patients about the safety of their own personal information. We are finding more and more incidents of these threats being coming to health system by exploiting an individual's record. And that is really important. We all have to be vigilant all the times. And unfortunately, a hacker has to be lucky once. And so, that is really key that we educate our users. We focus on re-education on emerging cybersecurity threat, and we, keep ourselves up to the emerging issues that are happening.
Yeah, yeah. Well, there's a lot to consider, and I know for you and other CIOs across the nation, those are the kinds of things that keep you up at night as you're leading in your healthcare organizations. Depesh, what have I not asked you that you think is important for healthcare executives to know as we are moving into and continuing, as you mentioned, over 30 years, and as we continue to almost see an expedited development of IT and AI and cyber issues? What should I have asked you that I didn't, or what would you want to share that I haven't asked you about?
I think, Cheryl, you asked all the topics that were top of every technology leader operating in healthcare or working with healthcare leaders. I think one important reflection we all have as individuals and leaders within healthcare is we are noticing that we are at the new dawn of technology leaders in healthcare, particularly because as we shift our focus from implementation of our core technologies like electronic medical record or ERP systems, we are making a significant shift toward how we can keep our IT operation more resilient, more affordable, and how do we adopt the up and coming new technology. And finding those balance, I'm finding our peer technology leaders waking up to this new dawn of the responsibilities that they are about to undertake. I think that will be a great balance. The other aspect that I feel is really important is how to become an operator by absorbing these new technologies into the core business function. That is another key aspect that IT has generally functioned as a function separated from rest of the organization, treated as a cost center. And we are seeing that trend coming into healthcare, what has happened in retail or banking and other industry, that how technology needs to be more and more and more embedded into the core business operation of all sides of our healthcare operation in general.
Yeah, that is a really powerful point that you make. Um, and thinking about it, you're just not handing over laptops and tools and making sure the systems are going, but you are partnering to be deeply integrated into operational decisions and how they impact the end user, which is often our patient. At the end of the day, the patient is the most important thing in that, and having a strong IT leader, IT organization that is enabling that care and able to help us effectively do it
Yeah,
is so important.
right.
I love that. I love that. Well, Deepesh, thank you so much for spending time with me today. I always love to see you and talk with you, and I hope you'll come back in the future and maybe we can debrief again and see what's changed.
Thank you, Cheryl. Thank you for having me. I enjoyed our discussion today.